Good morning. I am Bali Thorat and our presentation topic is Comparative Study of Global Severity of Tuberculosis. First we will see what is tuberculosis. Tuberculosis is one of the most serious infectious disease which is caused by Mycobacterium tuberculosis. Mycobacterium tuberculosis has a waxy coating on its cell surface due to the presence of mycolic acid. Mycolic acid are an important class of compound. It is found in the cell wall of a group of bacteria known as Mycolata taxon. There are two types of tuberculosis, pulmonary tuberculosis and extrapulmonary tuberculosis. Pulmonary tuberculosis affect to the lung organs, whereas extrapulmonary tuberculosis affect to the organs other than the lungs, such as skin, bones, etc. As per the World Health Organization, here we will see the year-wise statistical report of global TB cases and India TB cases from 2011 to 2016. Globally in 2011, 8.7 million TB cases were found, whereas in India 2.3 million TB cases were found, which is near about 26% as compared to the world TB cases. Here we can see that the ratio of the TB cases goes in the increasing order. From this 8.7 million, 1.4 million people were dead from this infectious disease, which is near about 15 to 16%. And the death rate of India TB cases is near about 13 to 15%. This disease affect to male as well as female category. From this 8.7 million people, 5.3 million were male and 2.9 million were female, which means that near about 34% TB were affected to female category. Tuberculosis can affect to children also. As per the WHO's report, near about 10 to 15% children will suffer from tuberculosis every year. Universally, tuberculosis is the ninth leading cause of death from a single infectious agent. Most of the people who develop TB disease can be cured with timely diagnosis and correct treatment. For this purpose, a lot of work has been done over the last few decades to develop effective point of care diagnostic techniques that are cheap, robust, and can be performed at high throughput in rural areas. Most of the technical improvement reported from labs but economical foolproof diagnostic assays are still lacking on the market. Here we will see some existing detection technique of tuberculosis. Conventional tests are smear microscopy and radiometric detection tests. In smear microscopy, the Ziehl-Neelsen staining is utilized, requiring minimum of 1 into 10⁴ bacterium per milliliter of sputum. However, sputum smear microscopy has a significant limitation in its performance when the bacterial load is less than 1 into 10⁴ organism per milliliter in sputum sample. Second test is radiometric. Radiography uses X-ray to visualize the internal structure of a patient. However, trained persons are required to operate the machine and interpret the result. The next detection technique is polymerase chain reaction. PCR is one of the most sensitive methods to detect the presence of MTB strain. Also, sequencing of PCR amplified DNA fragments is the most direct technique of detecting. PCR amplified DNA fragments are generally analyzed by electrophoresis. The main disadvantage of PCR is it requires relatively high cost of equipment and reagent. Conclusion. Current technologies for diagnosis are either too insensitive, too laboratory intensive, or utilize expensive detection modules, which are all the challenges in resource poor setting. Most of the recognition systems are still at the developmental stage and lack clinical validation with real TB samples from patients. As per the aim of WHO to completely destroy TB from world, design of proper system for recognition of TB within time, fast and exactly can lead a superior part in the foreseeable future. Thank you.